Welcome to the Cardiac Catheterization Laboratory here at University of Maryland Shore Regional Health in Easton. And today we're going to be performing cardiac catheterization procedures. The purpose of this laboratory is to invasively evaluate patients who have risk factors for coronary disease, symptoms of coronary disease and angina pectoris, which is a symptom of reduced blood flow to the heart, and then they've had non-invasive studies done as an outpatient that are suggesting that the patient may have significant coronary disease that's contributing to his symptoms. To perform the procedure, we will need to access the patient's central arterial system through the aorta. And this is a sheath. It's an arterial sheath. And this will be placed in the patient's femoral artery, which gives us access to the iliac vessels and into the aorta that lead to the heart so that we can take the images. The catheters that we use to take the images are preformed catheters that have been specifically made to allow us to pass the catheter through the aorta near the heart, and then are preformed to access either the left coronary arteries or the right coronary arteries, making the procedure quicker and safer. And then another catheter that we use will allow us to see the patient's heart strength and heart function. And this is called a pigtail catheter. And these catheters will be placed in the patient's left ventricle to allow us to see how well the left ventricle is beating, which is the strength of the heart. So the X-ray equipment will be helping us guide the catheter up. We can watch the wire first safely, and then the coronary catheter will follow it. And as mentioned, it's pre-shaped to find the left coronary artery in this case. And now the camera will provide different angles and different views that allow us to best see the whole length of the artery. Our screen here provides very important information, and the three most important things that we see here, four of them actually, are the images of the patient's heart. It gives us the EKG pattern of the patient's heartbeat. It shows us their oxygenation levels and how well the blood is oxygenated. And then it provides us an invasive evaluation of the patient's blood pressure. So that's the aortic blood pressure that we see in the red screen. Anne-Marie is my assistant here. She's a certified cardiovascular invasive technician. And then we have two nurses in here, Vicki and Vanessa, and they're providing all the medications and making sure the patient is safe and stable during the procedure. And then in the control room, Joyce and Ike recording the information we have and are helping to adjust some of the diagnostic information that we have here too to help the patient. That's what everybody's doing here. So now we're going to make some images of the left coronary arteries. The catheter is in the left main coronary artery that provides two of the major branches, and the artery that's going across the top of the image and down to the right corner is the left anterior descending artery. And the vessel that's coming out toward us, that's coming down toward the left lower corner of the image, is called the left circumflex artery. So we're now exchanging the left coronary catheter for a catheter that was pre-shaped to give us information about the right coronary artery. Very good. Large right coronary artery. So these are now images of the right coronary artery. The artery goes to the back side of the heart, and his right coronary artery is dominant, and there does not appear to be any significant disease in that vessel. We'll next take take images of the patient's heart strength, his heartbeat. So this catheter is a pigtail catheter, kind of self-explanatory why they call it that. And the catheter has multiple fenestrations in the very tip of it that allow the dye to come out in the ventricle and allow us to see an image of how strong the patient's heart is beating. Now the hemodynamic monitoring is going to show us the pressure waves within the beating chamber of the heart, the left ventricle. These are the red tracings that we see in the bottom of the monitoring screen. Good heart strength. All right. So this is an image of the patient's heart beating, and it appears as though all the walls of the left ventricle are moving appropriately, and his heart strength is in the normal range. Looks good. So now his images have been recorded, and we can go back through the images and re-look at the various arteries. And the pictures that we've taken show that there is atherosclerotic buildup in several of the branches of the main coronary arteries, and some plaque buildup in his main vessels as well. But none of these at this point are amenable to or appear to be the type that we would feel are necessary to provide intervention for, like a angioplasty balloon or a stent or bypass surgery. So his arteries are such and his condition is such that we would treat him with cardiovascular medications.